So I understand you're here for the shoulder problems.
Shoulder.
Can you show to the viewers, let's first start off with the right shoulder. What are you having trouble doing?
Try to put my arm all the way to the top.
And you mentioned trouble drinking. So.
Like when I drink like water or something, I gotta do this move all the way. So it's like I cannot drink like water like normally. Gotta do this. Because if you have some weight in my hand, it's like too much to do this.
So you go forward, but so therefore you have to wing it.
Yeah.
Gotcha. All right, so let's talk about the left shoulder.
This one I have a problem to go all the way up, and you can. When I go all the way this way, it's like cracking. My shoulder is cracking all the time.
Gotcha. Do that slowly for me, please. All right. Now try to go a little higher as you can. As high as you can. You're right.
Yeah.
You're right. You're right.
Then I have pain over here and all my neck over here.
Okay, let's go to the other side. Go ahead and raise that slowly then. See, now you start to recruit more. Okay, so this scapula is not moving whatsoever. Okay, that's not too bad. All right, so there's something going on over here. Now let's check what's going on over this side. Okay, your bicep tendon is really out. How's that?
Pain.
How's that right there?
Pain.
Good? Yeah, see your bicep tendon is way over here. It's supposed to be here.
Oh, okay.
But it's here. Okay, you jump the track. It's off the groove quite a bit. So that's why you have a lot of trouble trying to like raise it this way. You know,
okay. Stop.
Right, because the bottom line is, well, I'll demonstrate to the viewers in a bit, but yeah, that bicep tendon, it gotta be here in the groove. Now the nerves and also the structures and the muscles that's involved with your shoulders, okay, especially with this one raising it up here, I want to take a look what's going on in the nerves in your neck itself that supplies nerves function down to here, into your sits muscles, the rotator cuff muscles, okay? And then also in terms of why you have a little trouble like abducting the left shoulder, okay? That's usually dealing with the lats muscle, so we're gonna focus what's going on at this attachment area, okay? Because the lats goes from the shoulder all the way straight down to this region right here, all right? Okay. And it also connects the very tip of inferior border of the scapula over here, all right? In addition to, we also want to take a look what's going on in the middle area over here, right? In terms of biomechanics for the scapulas, and also subscapularis, the ribs, and so on and so forth, okay? So we got that component. Now you also talked about, okay, the elbow, again, that's lower cervical, so we'll take a closer look at examination on that. Okay. In addition to the low back. So now we start tying things over, so since we're dealing the lats connected to here and the low back pain, let's take a look, is the foundation itself, is that stable, all right? Well, here's the thing, as the viewers can see already right off the bat, this is lopsided down this way. And when we take a look over here, the sacral base angle, okay, I want it normal over here. It's backwards. So what can cause that one to go backwards? Usually this could be a posterior rotated sacrum, you know, a sacral segment issue, and an ASIN or ASIN ilium. So that's the potential areas we want to focus on. Now, that being said, okay, I also want to take a look at, just like driving a car. Okay, if I'm turning the steering wheel to the left, the car should turn to the left. The car should not be turned to the right. Correct? So that's what I want to double check on you. So with this one over here, keep that in mind. Backward sacrum, so just going to be back, you know, posterior sacrum, or ASIN, you know, ilium over here. So now we take a look at the AP section over here. Now, sacral segments, are they leveled? They're not. Every single one of them, it should be level, straight like this. Everything's tilted this way. Okay. And when we start to move upwards, okay, second sacral segment is already, it's tilted this way. And I also see the big wedge gapped open like this right there. So we need to rule that out. Right? And also, see this over here? It's supposed to be nice and smooth, but we have a little bump over here. So that tells me, no, that's an old fourth sacral segment, which is very common when babies, they start falling at butts all the time when they start to learn how to walk, okay? So that thing healed up not so properly over there, but most likely that's not going to be a fella because I see these fellas in proper alignment, except there's two of us over here. So we have one potential candidate to verify on you during the examination, and also because this thing tilted downwards this way, all right, we got to take a look in terms of what's everything's going on, all right. So now the line over here, I want to smack in the middle. It's over to the left. So that tells me, no, we have a potential EX misalignment. So what's the width over here compared to this? Yes, this is a little bit more narrow versus this one over here. So we have a potential EX over here. And then this is going to be the IN side. And in addition to the vertical height. Okay, they're pretty much very similar. So we have a potential PIEX over here and an ASI over here. So that being said, because this is sucking down this way, okay, a PIEX or PIEX will level it this way. ASIN or ASIN will drop it and level it down that way. So again, we're going to confirm on you which one we need to address. Are we addressing the sacrum itself or this right ilium over here? And in addition to, now we look at the next floor upwards. Okay, this is your fifth lumbar vertebrae, right? In relation to what's going on to the fourth and the sacrum over here. This fellow over here, it went backwards and tilted down this way as well. So you can see the tunnel collapse, irritating that nerve, and that could help explain why you feel that pain going on your left leg. So we got that one aspect, okay? And because it's leaning like this, it's sort of like having a chair, you're leaning way back on your rear two legs over there. Okay? That's incredibly unstable. So that's what's causing all the arrested instability, all the straight upwards, all right? And also causing irritation to right there, possibly to the lats. So that's one aspect of it. Another thing, when I'm sort of looking upwards, straight up to here, now we got another issue I'm seeing at what happened to your fifth dorsal vertebrae, all right? This is tall, this is short. This should be a nice rectangle shape, all right? Same thing, it's a little hard to see, but number 6 is also doing the same thing as well. Tall, little short. So, therefore, what happened to this bone? Instead of being a nice rectangle shape over here, it got squished and crushed. So this is what we call a compression fracture. So why is this important? Well, just like a tripod, okay, and I'll show it to the viewers over here, okay, we have the facets over here. We also have the nucleus pulposus, the ball bearing over here. So it should be like this, a tripod effect. We should have nice, stable tripod. Now, because you had the compression fracture, okay, and the bone got crushed, it's now sinking down. Okay, so instead of being here, now it's here. So therefore, instead of being completely upright, now you have no choice but to slouch a little bit. All right. So not only 5, but 6 is a little bit crushed. So why is this one start being important? Is because this fellow over here biomechanically is dealing with the ribs to both of your shoulders. And I do see symmetrically over here, number 5, they're not level, they're not stable. All right. So this, because now the ribs are starting to pop out of alignment due to the vertebrae, because again, our ribs, they're connected to here, to the transverse processes over here, like this, okay? But now because we're dealing with the bone is backwards and it's rotated, okay, it's gonna pop the ribs, okay? It's gonna slightly misalignment, and we're gonna confirm that on you during examination, right? But I see over here, yeah, these ribs, they're misaligned. So because now it's like a little bit off, the scapula, okay, instead of being nice and smooth like this, and the scapula needs to glide and move around it. But if the rib is like out, what's gonna happen? It's gonna catch on it. It's not gonna biomechanically be very smooth anymore, right? So that's why it's very important to make sure the ribs themselves are in proper alignment. And then we also go up to the cervicals over here. Yeah, you can see this is nice and straight. But over here, number 5 is just slightly backwards over here. And we see it's gapped open on that side over here. So yeah, we're gonna rebalance, rescue, and stabilize the spine first. I'm gonna double check what's going on over here, here, and here as well. So just like I alluded to before, this is where, you know, visualization and also static palpation come into handy. You feel that over there?
Yeah.
this big hump, that's a rib. So we're gonna mark that, okay? Feel that hump right there too?
Yes.
Yeah, so you got another rib here too. So this one's also out too. So, and also, bam, it's puffy. So keep that in mind. And it's puffy and swollen down here as well. Okay, so we have some muscle spasm, tightness over here as well. Okay, so now we got that set. These are the areas the structure has been damaged, and the body is initiating that inflammatory process to start repairing the area. And one of the byproducts is going to be abnormal heat. All right, and this device over here, like a thermometer, is picking up increased heat. All right, the nerves being irritated on the right-hand side over here. We're scanning the rest of the spine. And we got another one right here. We have another one right there. Yep. Gotta be right there. Get it down a little bit. How's that fella right there? Right there.
Yeah.
Yeah, right?
Pain over here. When you move it, felt pain over here.
Gotcha. Not too bad, right?
No.
But it is stuck. So there's a inferiority of that fifth lumbar, what we confirmed on the x-ray there. So we'll keep an eye on that. How's this fella right there? See, that's your fifth dorsal. That's not moving. That's locked up. See, your rib, both your rib heads are out. That's unusual. Doesn't happen all the time, but we got one. How's that fella right there?
Bit of pain.
Yeah, it fits a little. Keep on dropping. A little more.
Oh.
All right, guys. So here's a tricky part about this case here, right? Now, on his fifth dorsal vertebrae, what happened was it rotated towards this way and this way. Okay. So now, because this rib is sticking like crazy, it popped up this way. Okay. If I adjust this last, okay, it's gonna be a problem because when I correct it, it's gonna be back over here. I set the rib, it's gonna go right back to square one. So we sort of like took 2 steps forward, 2 steps backwards. That's why I need to set the rib right now. And then I'm gonna set this as a PLI-T, and we're gonna set this other rib. So when contact over here, even though this one just temporarily makes it more this way, when I go ahead and adjust and correct that vertebrae, we're gonna address the right rib and also recenter it back here. Drop the belly. Go ahead, drop the belly. Little more. There's one. Let it go. See, this just unlocked the scapula a lot. Now we just gotta get the rest of it. See, this is gliding better. We still gotta get this one. Right there. There's the rest of it. Okay. Come on up. Okay. Let's show to the viewers over here. Okay, go ahead. Raise this left one. How high can you raise it?
A little more higher, but still.
Good. All right. Then I'll get to that because the nerve in your neck goes to this area. So we'll address that in a moment.
Okay.
Raise the right one.
This way or this way?
Like try to drink.
Oh, yeah. It's much better. Yeah.
Now, if we could pretend like this is like the bicep tendon over here, right? It's supposed to be in this groove over here. There's also a ligament that keeps this bicep tendon in place. However, when we start to have a subluxation, that means a bone that's knocked out of alignment and with a traffic jam in the way, reducing nerve function. So not enough nerve is going to this ligament. So instead of being nice and So instead of being nice and tight like this, it's going to have some slack in here. So when it gets nice and loose like this, it doesn't take much. Every time you use the shoulder and move it around, what's going to do? Then suddenly, bam, it's going to start jumping the track like this. All right? In your case, it went way over the groove like this over here. So now what we're going to do is every single today's visit and also following visits, we have to restore the nerve function to your shoulder over here. All right, reduce the traffic jam, get this ligament over here much more stronger, and over time we could get this tendon back into its groove like that.
Okay.
And then make this nice and firm over here. You feel that right there?
Yes.
Okay, that's a tendon. This should be here. It's quite out. So we're gonna rotate. Okay, I'm hooking right onto the tendon. All right, hold on a second. Just gonna rotate and then pop it back in the groove. We're gonna get a little more out of it. There it is. There it is. Let's check this. Okay, SC's working, AC's working. This is, you still have a slight external rotation problem, so we'll get the rest of this. There it is. Here it goes. Let's check this one. SC, AC, anterior, posterior glide, okay. Slightly out too. Let it go. No, let it go. Here it is. Good. Overall, how's this left shoulder doing right now?
Much better.
How much better would you say?
Like 90%.
90%. Now, how's the right one doing?
Yeah, much better. Now I can drink my glass of water or my beer. Very nice.
See, that's important there, right there, right? You gotta drink that beer.
Yeah, they gotta drink the beer. Yeah, much better.
How much better would you say?
It's like 90%.
90% better. Nice.
Yeah, much better. Because I cannot, before I can even do this, like, nice. Now I feel much better.
Nice. All right, well, that's what it's all about, all right?
Yeah.
Okay, so let's keep it all up. We're gonna check and see how you're following along in the next following visit, all right?
Okay.
All right. Oh, you're welcome.
Thank you.
All right, take it easy.
Thank you.
So it's the second visit. Give us the latest updates. How's the shoulders, everything else coming along?
Much better. I don't have no more, like, I don't feel my shoulders too heavy, so I can easily move with my both shoulders, so I feel much better.
Oh, nice, nice. Thank you very much. Thanks for the updates. All right.